Surgery, pick up line 22. With the orderly on duty, please come to reception.
Today we're here to talk to you about when and when not to come to an emergency room. First of all, the word emergency means emergency, which means don't come to an emergency room for problems that are of chronic nature. Don't come in for your immunizations. We don't really give them except for tetanus, and there's no reason for you to come in at 2 o'clock in the morning for those. You will not get mumps in the next hour without them. Don't come in for prescription refills. Contact your primary care physician. He is the one, or she is the one, who's responsible for your health maintenance. You come into an emergency room, even though in this day of electronic medical records and theoretically every doctor knows everything about you, it's not really true. And the truth is, things like hypertension medication, things like cancer medication and such are really not best handled by an emergency physician. They are handled best by a primary care physician. Get one, know one, talk to one. They know you the best and they will give you the best care for any chronic problem that you may have. The emergency physician is all geared to the emergency. Not to, my blood pressure is a little high, I don't have chest pain, I don't have shortness of breath. I went to the grocery store and found that my blood pressure was high in that dumb machine. By the way, those machines don't work very well, and it's meaningless. Blood pressure is a snapshot of what's going on at the moment. If you're upset, if you're crying, it all goes up, okay? See your doctor. We have various patients that come in at 2 o'clock in the morning for reasons I have no idea. Number one, I think I'm pregnant. I need to check this out now. There is rarely any medical conditions that you need to know if you're pregnant at 2 o'clock in the morning. You can buy a pregnancy test for $8, pee on the stick, and find out if you're pregnant.
Uh-oh.
So what should you come to an emergency room for? Chest pain is the first one of them. There are various diseases that cause chest pain, all of which have to be checked out. This is not to say that you have that, but they need to be checked out. Shortness of breath. Shortness of breath means that oxygen is not getting to the vital organs of your body. Sometimes it can be just anxiety, but sometimes it can be an actual problem where oxygen, which is supposed to go onto your red blood cells, are not getting to your brain, to your heart, and to other vital organs. Come into the emergency room if you have shortness of breath. Let's sort of divide up the trauma. Trauma, I stubbed my toe. Don't come to the emergency room. Trauma, I fell. I'm 22 years old, I skinned my knee, I picked myself up, I walk 2 miles to school or whatever. You probably don't need to come to the emergency room. These are the reasons you should come to the emergency room. If you did hit your head and you were truly nauseous, especially if you're vomiting, please come to the emergency room. Nausea, vomiting, okay, and feeling generally ill after falling and hitting your head can be a sign of concussion. It can also be a sign of having an intracranial bleed. That means you're bleeding in your brain. Obviously, this needs to be checked out. If you're relatively feeling well after trauma, you probably don't need to be seen in an emergency room. Noted exception, if you're actually having neck pain as defined and has been researched, the neck pain should be in the midline in the back. That means divide your neck into 2 pieces. The middle part is where you should be touching. If you can find that you really have pain in that area, that needs to be checked out, because there is always a possibility that you broke a bone in the neck. This happens rarely. If you have trauma such as motor vehicle accidents, again, most of the time, these are fender benders. Fender benders rarely cause problems in anybody. Okay, so if you wear a seatbelt, which of course you all should, and you're having real abdominal pain, that needs to be checked out. Especially if you look down and you find you have a big black and blue mark where that belt was. That's called belt sign, and is highly indicative of an intra-abdominal problem, possibly a liver or spleen laceration, so obviously we want to see you. Okay, let's look at one notable exception to everything that I've said so far. If you are a person on a blood thinner meaning Plavix, blood thinner meaning Coumadin, or some of the newer anticoagulants, you need to be evaluated even if you're feeling well. The reason is these drugs, by their nature, and the reason your doctor puts you on them, is they thin the blood. You don't clot that well. There have been many, many instances of patients having relatively minor trauma and then ending up with an intracranial bleed, a liver bleed, a splenic bleed, and this all needs to be evaluated. And a lot of times it needs to be evaluated with a CT scanner. So if you are on a blood thinner, make sure to come in. If you're coming in because your attorney says you need to see a doctor, please send in your attorney instead. I'd rather see him and do painful procedures on him.
Uh-oh.
Most attorneys are not JDMDs, i.e., they know nothing about medicine. What they're really trying to do is make a case. Doctors are not interested in whether you make a case or not. We're interested in taking care of your healthcare needs. So, if you had an accident 2 or 3 weeks ago, and now we're getting to the attorney, and the attorney says, you better get to an emergency room immediately, ignore him. We don't want to see you. By the way, you do have a primary care physician who, by the way, also doesn't want to see you for this kind of problem, but unfortunately he has to. If you have a laceration, which is really just a cut or a slice to skin, okay, and it bleeds initially, and it looks like the skin is separated, you really probably need to see an emergency room physician. Most internists, primary care physicians will not sew you up or fix that laceration in their office. They will see you and then send you to the emergency room. If you have a puncture wound, most areas, probably you need to see an emergency room. The reason being tetanus status. We need to know whether you need a tetanus shot. The point is most lacerations need to be fixed to some extent. Nowadays, everybody worries about the pain, the shots, to numb the thing up, and all that. A lot of minor lacerations we now fix with glue, okay? This is, believe it or not, good old Ace Hardware glue, super glue. But of course, it's medical grade, so it costs a little bit more, but it's probably worth it. It also comes in a crowd-pleasing purple color, which eventually turns clear. So we can fix most of your kids with this glue. If it's wide and gaping, you will need stitches. Scarring, yeah, there's going to be some scarring, but most emergency physicians are trained to minimize scarring if at all possible. Scalp lacerations bleed like stink. Come on in, get them fixed. Because if you're bleeding to begin with, chances are even if you're not bleeding now, the next time you take a shower, you will bleed. Come in, we'll sew it up. And we have sutures now that you don't even need to come back and have them taken out. They fall out by themselves. So lacerations, please come on in. We love it. Well, thank you very much for your time. Be healthy and be happy until the next time we meet.